Like many cancer centres worldwide, we face an increasing demand for our services. So if we can reduce the amount of time it takes to plan a treatment, that makes a significant difference to the workload on the staff.
The bottleneck is the level of expertise of the planner and the complexity of the case.
One of the biggest challenges in radiation oncology is to cover the target while sparing the organ at risk.
RapidPlan software is a knowledge-based software.
It's a treatment planning tool that learns from an institutional experience so that when you have that next case, it says, this is what you're going to be able to achieve. At the Henry Ford Health System in the Josephine Ford Cancer Institute, we treat about 14,000 cancer patients per year.
We've treated lung SBRT for almost 10 years now. So when we trained the RapidPlan model, we had a really large selection of lung SBRT plans to choose from. We chose 105 of those plans, and what we looked for was that variation in geometry.
This is 42. It's perfect. And what RapidPlan offers is that I can say, look, I've treated 3,000 of these cases. Let's take our experience, let the engine learn from that. What are the parameters? What are those trade-offs that we value? So that in the clinic across the globe, they can run a case and offer that same quality of care over there.
Institut Sainte-Catherine is one of the most important departments in France. Currently, we use RapidPlan for prostate disease and head and neck disease.
Using RapidPlan really helps us to find consistency and to obtain the best trade-off between coverage of the PTV and the sparing of the organ at risk. You can see here that the PTV coverage is really good, and we can also see that sparing of organ at risk is really good.
RapidPlan saves time, so we can better implement new method and new technology.
We were the first centre to treat a patient using RapidPlan clinically, and that was a prostate patient. Less experienced staff can find treatment planning a very difficult and time-consuming task. What we've found since we've introduced RapidPlan is that all dosimetrists take approximately 20 or 30 minutes now to produce a plan, and in the studies that we've done, we're saving on average 90 minutes per treatment plan. Which sites do you think we should move on to next?
I think the next major site will probably be head and neck.
RapidPlan has the advantage that even relatively inexperienced dosimetrists can use the software and produce a clinically acceptable plan in a very short space of time.
It's definitely confidence building to know that you have this plan that you can use that has been treated before at another larger institution.
Working to help develop software that'll help overcome that knowledge gap. That's why we're here, to offer the best quality of life, best clinical outcome, day in, day out, to every patient that we see. That's why RapidPlan is a very powerful tool.